So I'm not going to be talking about papers or anything like that. As the email suggested, it's a special presentation, which made it sound very important. What I'm going to be talking about is sort of the party drugs and harm reduction advice according to that. This session is going to be recorded, so any contributions that you're going to give are going to be recorded, just to let you know. If you could, as usual with the teams, can you put your mics on mute so we don't get any feedback? That would be great. So I'm going to do a presentation about sort of different party drugs and harm reduction advice, and then we can talk, we'll have a discussion about it, really. It's quite informal, and I'm going to have John Robbins and Dr. Nikki Kalk to help me with the discussion around that. Why I did this is I think this is a really big gap in our knowledge as trainees, especially when we talk about substance abuse, misuse. We have, you know, we get taught about heroin replacement and cannabis and things like that, but actually the recreational drugs, I feel like it's a massive gap in our knowledge. So, but you're gonna have to bear with me because I'm not technologically that minded. What I'm gonna try and do is share my screen. Right, here we go. So first thing I want you to look at is this questionnaire. So usually I send it out, but obviously it's a different situation. So I just want you to have a little look at the questions on this and see if you can maybe, if you know the answer to them. Because these are questions I got asked when I started doing some volunteering, and to be honest, I didn't have a clue. So they're just some questions I'd like you to have a little look at and just maybe keep at the back of your mind. And can everyone see this?
Yeah.
Yeah, okay, cool. Yes. I don't know how fast to go, but it's just to sort of get you in the mood. And usually I get people to do this questionnaire before and after the talk, but obviously it's a bit harder now. So I'm just sort of showing you the questions just to sort of maybe see where your gaps in your knowledge are and whether you think as psychiatrists we should be really knowing these things. Go up here. Right, I'm going to go back now. Save. Right, so, okay, so, oh, sorry. Right, so can you all see this?
Yeah.
Lovely. Okay, so let's start the presentation. So this presentation is really on safe sesh. So recreational drugs and how, so basically a little education about the different types and then some harm reduction advice. And then we'll have a discussion at the end. So we're going to talk about why I think this is an important thing to be taught or looked at least. We're going to look at the effects, dosage, duration and harm reduction for different recreational drugs. And then some useful resources you guys can look at, and then a discussion at the end. Why do I think it's important? Well, so from the statistics on drug misuse, in 2016, there were 2,593 registered deaths in England and Wales related to drug misuse. So that's a 5% increase from 2015 and 58% higher in 2006. Drug-related deaths are at the highest level since records began. And there's a lot of admissions with a primary diagnosis of poisoning by illicit drugs. So it's not like an addition. It's the primary reason for going into hospital is because of overdose or poisoning. And that's a 40% increase from 2006 to 2007. So it's a problem and it's getting bigger. And there's obviously lots of campaigns about drugs. The war on drugs is lost. If you remember back in the, I think it was 60s, 70s and 80s, there's, you know, a war on drugs and the advice was just never to take them. That isn't happening anymore. The war on drugs is lost. People are taking them. And I think unless we we start to accept that and start maybe looking at a more safe approach to this rather than just abstinence, then this problem is just going to keep growing. So there's a lovely picture of me. I volunteer at a organisation called The Loop. I don't know if any of you have heard of it. It is a charity organisation that basically does recreational drug harm reduction advice and welfare at things like festivals. They do testing, so it's really good. So this, I don't know if you've heard of them, but they do it in some clubs, they do it in most festivals, and they've started doing street testing in Bristol. So you actually take your drugs to them, and there's like a system, like an amnesty box. It's in partnership with the police, even Class A's. We'll test them for you in our little lab that we have in a porter cabin, and then we will give you the results, tell you what's in them, tell them the strength, and then the part of the program is when you get your results, you have a harm reduction talk by a professional. So that was me. They also do welfare. So that's not just, if you see like the medic tent at festivals, that's sort of for the medicine side. Welfare is more for people who are sort of tripping on drugs or having ill effects of drugs who don't need medical attention. Usually they get cleared by the medics and then we look after them while they're in that state. And we also do harm reduction, which I'm going to talk about in a minute. So as part of the Loop, you can follow them on Twitter or Instagram. And what they do, whenever they find dodgy drugs, they send out alerts. So on social media, and also if you're at a festival, they'll send it on the festival-wide app, just so people know. So there's an example here of an alert they sent out for a Donald Trump pill. So that was at Lost Village in 2019. So it was going around the festival. It was a high-strength pill. When we tested it, it contained over 300 milligrams of MDMA, which is 3 times the common dose. And so that alert went out over the festival to tell people, you don't take, well, if you're going to take this drug, you should at least cut it in half into quarters. There was another drug that actually I saw when I was so I did Bestival 2 years ago, and this drug, this ethyl pentalone, was actually there. This is like a new sort of chemical that's been coming out. It's usually sold as MDMA because it looks the same. But it reacts much differently. So I actually saw a couple go completely psychotic on this who never had any previous mental health problems. It looks like MDMA, but actually the effects are a lot longer. So you can look, it's 12 to 72 hours. And what happens is the people have severe insomnia and they can't sleep. Either you have to load them with benzos, but the process is they don't sleep and then they become psychotic. So actually I saw this in Vestibule with 2 people. So that when we test for that, we'll send out like a big alert as well, because most people don't know. That's the problem. So this is the club drugs wheel that I had in the picture of me on the previous slide that they have up in the tent. It's just really this is just to classify drugs really, but I found it quite useful. So the drugs are in the sort of inner circle, and they get sort of less illegal as you go into the center. But what is good is it splits them up into their different categories and then tells you the sort of side effects or effects that you'll be chasing for these types of drugs. So it's just like a little guide really. So if we're going to let's talk about first about MDMA. So MDMA, you can have it in, if you look at the picture, you can have it in this sort of crystal form or in a pill. The effects are, so the positive effects of MDMA last about 3 to 4 hours. Everything is perfect with the world. You have a euphoria, empathy. People get quite huggy on MDMA. You love everyone, which is why sometimes it's called an empathogen. It makes you very empathetic. Connection with others and nature. The negative effects, however, last a bit longer. So what MDMA does, it's sort of, you start off with this euphoria and then the tail end of it is a more stimulant effect. So you just get the pure stimulant effect. So then you get the dry mouth, you get the gurning, which is the jaw clenching, lack of appetite, palpitations, not sleeping, that kind of thing. Risks are overheating. So this is when you see the deaths from ecstasy, this is what's happening usually, one of these 3 things. So you lose the inability to keep yourself cool, especially if you're in a festival or at a club and you're dancing and you're sweating. What happens is you overheat. You can get water intoxication if you drink too much water, and you can also get serotonin syndrome. It depends on, so this is when it sort of kicks in, it depends on how much food you've eaten, and you should really dose it to your weight. So this is the only drug that you dose according to weight. So a heavy dose is 200 milligrams. If you think back to that pill, I think it had 300 in. So those kind of, if you took 2 of those pills, you'd be in big trouble, basically. So when we're at the festivals and we're giving harm reduction advice to these people, so they've given in their drugs, people have lots of questions about it. They don't get the drugs back. They give them in, we test them, and then we tell them what's in it and the strength, and then we tell them about how to take them more safely. We have to be very careful with our wording, because obviously we don't want to be seen as teaching people how to take drugs. So it's very sort of political wording that you have to use, such as, you can't say, oh, you should cut that pill in half. You say, current harm reduction advice would be that you should cut it in half. It's very, you don't want the Daily Mail to get hold of it, basically. But anyway, with all drugs, harm reduction is you start low and you go slow. With MDMA, you want to have a scale for the exact amount. You're not just guessing, because it's according to body weight. If it's in a powder, or any drug in a powder, we say to crush it, dab on your tongue and wait to see how it affects you. And with pills, don't just pop a whole pill, try a quarter and wait and see how you go. For the overheating, you want about a pint of water per hour, and you should set a timer, because you can lose sense of time. Keep an eye on your temperature, and be aware of food and time rest, because of the stimulant effect. You'll forget to eat, and you won't sit down, you won't sleep. And we always say, if there is a if you're in a group, that maybe one of you shouldn't be taking drugs, to look after each other. Talking drugs, which is you can see the logo at the bottom, make these really good handouts for different drugs. So these are up in the tent as well. It's basically all the stuff I've just been saying, but in a handy little leaflet. So you can actually download these yourself and look at them on the internet, but they're really, really good. We're going to go on to ketamine now. So ketamine it gives you, as most drugs, it gives you euphoria, which is what you're sort of going for, and spiritual experiences, an enhanced sense of connection, increased energy. Negative effects are, we know ketamine is used for sort of pain relief and things. So it gives you pain relief and numbness, which is not always a good thing. You can have disorganized thinking, you would become very uncoordinated, and you can dissociate quite heavily with depersonalization. You can have these things called cat legs. I don't know if you've ever seen anyone with cat legs. So basically, it's like their limbs aren't attached to their brain anymore. They have no control over their legs. And you can get quite bad stomach cramps. So risks for ketamine are, so you can dissociate. You become very vulnerable on ketamine. It's not a drug that you want to take at a festival with lots of people, because you literally dissociate, and you're not really in control of your body. You're in a very vulnerable position. Repeated use can cause quite severe bladder damage, and in overdose you can have what's called a K-hole, which is an intense out-of-body near-death experience with very realistic visual hallucinations, which can be quite unpleasant, and you can't really do much about them. I remember there was a story of 2 girls at Glastonbury who took a lot of ketamine and sort of passed out on the floor. And when they woke up, somebody had taken their phones and taken pictures of them on the floor to show them, basically how vulnerable they were. So ketamine is not really a drug you want to be doing in big crowds. It's got quite a fast, compared to MDMA, it's like quite a fast duration. It comes on quite quickly, doesn't last that long. So you see people usually bumping it quite often. And when I say that, I mean snorting it, like snorting little doses quite often. So these are the sort of dosing. If you're gonna start overdosing or K-holing, you're in the 150 to 250 milligrams. It's known as a dissociative anesthetic state, so numb, not in your body, sort of out of body experience kind of thing. And just to give you a sort of reference, if you think of a line of Coke or a line of ketamine, that's about 50 milligrams, like an average line, just to sort of give you an idea. It's hard to imagine milligrams sometimes. Okay, so harm reduction advice with everything: start low, go slow. Not ideal for crowds because you can become hugely vulnerable. Anything that you snort, you shouldn't share straws. Things like having your own post-it as your straw and keeping it as your own rather than sharing straws. Not using money because it's filthy. Use low quantities and not frequently. Oh, sorry, I've got a typo on there. Not hat frequently. If you use it sort of weekly, you're going to get quite nasty bladder damage. You want to be measuring it as well, because if you're anywhere near that 150, 200 milligram mark, you're going to be K-holing. And you want to avoid any other depressants, so alcohol, cannabis, that kind of thing. And again, set a timer for redosing, because it has a short half-life, and when you're in that dissociative state, you will lose all sense of time. So it's always good to set a timer. And here's the talking drugs safeguide use for ketamine. So it's basically what I've been saying. And as with lots of things, if you're snorting anything, you should be cleaning out your nose at the end of the night, because what you don't want is to have bits of it left in your nose. Okay, cocaine. So positive effects, you get a bit brave, overconfidence, clear head, increased alertness. I don't know if you've heard of people taking cocaine and, cleaning their house. Energetic, euphoria. Negative effects, it's a stimulant, so decreased appetite, dry mouth, repetitive behavior, sweating, that kind of thing. Risks are, so it's a drug that you usually snort. I don't know if you guys remember that actress, I can't remember her name, who lost like her nasal bridge from snorting too much cocaine. So it's an irritant, and it can cause quite a lot of damage up your nose. There seems to be a big infection for hepatitis C specifically with cocaine use. They're not really sure why. It's not the same for other bloodborne viruses, but it seemed to be that hepatitis C was a growing problem. And as it's a stimulant, obviously, if you take too much, you can have cardiovascular problems. So you can snort it or you can rub it on your gums. It starts pretty quickly and lasts about half an hour. And there's the dosing for that as well. If you remember, if you think a line is about 50 milligrams. And this is a stimulant drug. And this is just some articles I picked about that, what I was talking about, hepatitis C. It was called a silent epidemic back in 2000. So it's a risk, which is why there's a big drive for like not sharing straws and having your own straws. So again, as with everything, start low, go slow. Don't share your straws. Use a clean piece of paper. You don't want pound notes. You want to douche your nose afterwards, and be aware that with cocaine especially, you can get quite carried away. So you want to be aware of the frequency of your consumption, and make sure you're not sort of double dosing. You've got to wait in between. And there is the talking drugs safe user guide for cocaine. I don't think there's anything on there I haven't said. No. Oh yeah, so especially with cocaine, you want to avoid drinking. Alcohol is really not great with any drugs, to be honest. There's a drug graph that you can look at to see which drugs go with what and what they do when you have them together. And alcohol, as it's a depressant, it's never usually a good idea with like most drugs. But everyone does it. You're drinking, you're taking drugs. So a little bit on psychedelics. I'm not going to go into all the different ones. There's lots. This is just a sort of general overview. So as a general overview, psychedelics can give you spiritual experiences, euphoria, synesthesia. I don't know if anyone knows what that means, but that's the kind of experience where you can see music and hear light. Your sort of senses get a bit muddled up and can be quite pleasant. Negative effects are insomnia, unexpected emotions, loss of sense of self. These I just picked LSD and 2CB. So LSD is really long lasting, as you can see. It's like a 12-hour trip. So the importance with psychedelics is what we call set and setting. So because it's a mind-altering drug, really. So you've got to think of your mindset before taking it and the setting that you're in. So your environment. These are really important according to, if you're going to take psychedelics rather than dosing it. Because if you're having a bad trip, it can lead to psychosis, accidents, and it's more about your mindset before you start taking them. So this is about crystal meth. So I've sort of, these, from the crystal meth and the G, I've sort of stolen some of Nikki's slides. So thank you for that, Nikki, because I didn't have them included in the talk. But so we'll talk a bit about crystal meth. It's methamphetamine. It's part of the amphetamine family. Usually a crystal, smokable crystal. You can also inject it or slam it, as it's called. We see it a lot in the Chemsex scene. So I've done Liaison in Tommies and Kings, and it's a Chemsex drug, so you usually take it IV as part of Chemsex. And so it lowers your inhibitions and increases your libido. So obviously that's why it's been used as a Chemsex drug. So these are harm reduction advice for meth. So you want to make sure that the meth is completely vaporized. You don't want any liquid in there. And then if you're injecting, it's the same sort of harm reduction advice you give with anyone who's injecting drugs. And then GBL, again, another Chemsex drug that you see quite a lot. I find this quite interesting. It's found in like lots of household things. You can find it in stain removers, like a little clear chemical. But why it's so dangerous, it's got a very small window of I don't want to say therapeutic window, but it's got a very small window. And if you take too much, which is like millimeters difference, you can have really bad effects. So this again increases your libido. It's like alcohol without the hangover, basically. But it's really, really addictive. And you should be dosing it. You see people dosing it with like a pipette or those little soy sauce fish things you get with sushi, because it's milliliters of difference. It's used, like I said, with crystal meth in Chemsex usually, and the withdrawals, because it's so addictive, the withdrawals could be quite severe. So like I said, it's really crucial with the dosing of G, and so that's what they usually use pipettes. And just with all things, harm reduction is start low, go slow. So amphetamine use is actually quite uncommon in the UK, but I think just because of where I was working in St Thomas's, which is quite close to Soho, I've seen it quite a lot. For meth, so if you look, so the blue is harm to users and the red is harm to others. So amphetamine, it carries a large burden to the user. You can, if they have an acute, so this is just like a Venn diagram of the psychosis you can see with meth. It can look like schizophrenia. You can have, and it's different in acute and chronic states. I don't know if any of you have seen it in A&E, but you don't really forget it. So this is some data that Nikki has got from KCH. So mainly male. So this was to look at meth and G use. So if anyone comes in with, well, either or, you want to ask about the other one, basically. So that's just from these are just the percentages from KCH, just as a sort of flavour. So this is a pie chart about what people sort of present with. So odd behaviour, so we're sort of like looking at psychosis area there, G withdrawal, physical health complaints. It's just like an idea of what you'd probably see in A&E. Okay, so this is just some of the resources that I've been using. which I suggest if you're interested in this kind of stuff, or you're going to be doing on calls in A&E, or you just haven't got a clue about drugs, because that's the thing, isn't it? They're illegal, and so it's all very hush hush. Don't really talk about it openly. I don't think we're really taught about it, but our patients take them. So I think it's definitely something we should be knowledgeable about. And I don't know about you, but when I first looked at that questionnaire that I showed you at the beginning, I was given that and I didn't have a clue, and I was quite embarrassed that I was a psychiatric doctor working in a central London A&E and I couldn't answer these questions, and I should be able to. So if you want to have a little look, these are really good resources. There's this thing at the bottom saying Reagent Test UK, where you can actually buy the tests that we use at the festivals, and you can test your own drugs at home. So you can point the people in that direction. What it'll do, it'll tell you what's in it. And so it'll screen for things like that pentalone, you know, that psychotic chemical, and it'll tell you what's in it. Just for some stories from when I was at the festivals, people were bringing in pills to get tested, and they were sold usually as ecstasy. We found everything in them. One of them was pure plaster cast. It had no drug in it at all. They were just taking pills of plaster cast. It must have been a dodgy batch, because we had a few people come in whose pills were actually made of hydroxychloroquine purely. So obviously somebody had made a load of fake ecstasy pills out of hydroxychloroquine and sold them on site. Like I said, we had that pentalone being sold as MDMA. We had a few psychotic people, and in one of them, they actually just had gravel in their pills. So it's always really important to test your pills, because you don't know what's in them, and your powders, of course. And I just thought this was like a really good thing that we were doing. And I know they had to get through a lot of legislation to even have it there at a festival. But I thought we really helped a lot of people. So that's the end of my presentation. Why I wanted to bring it up, I just wanted to have a discussion about, you know, as psychiatrists, should we be talking about harm reduction specifically to our patients? So instead of saying, oh, you know, if you have that repeat person who comes in saying, oh, you should stop taking drugs, you know, go to Lorraine Hewitt House, you should be doing this, you should be doing that. Should we be giving them harm reduction advice? Do you think that's in our role? Do you think that's right? Do you think that's wrong? And do you think as psychiatrists, we know enough or get taught enough about recreational drugs specifically? So the kind of things I've been talking about, do you think it's something we should be taught about? Or, you know, should it be left as it is?